Thank you for joining us. During this presentation, we'll be walking through the Louisiana Department of Health recommendations and process for contact tracing in schools and how to report suspect and confirmed COVID cases to the school COVID-19 reporting portal. My name is Jenna Iberg Johnson, and we also have Sean Simonson with us today, and we're both from the Infectious Disease Epidemiology section of the Louisiana Office of Public Health. We hope this information will be helpful to you all, as we do recognize how challenging it has been for students, parents, teachers, and school staff and administrators to plan and prepare for returning to school. And our goal is to keep schools open, and in order to do so, it is critical to respond proactively to suspect and confirmed COVID infections in the school setting to prevent further transmission. So our main tool to do that is contact tracing. And it's critical to conduct immediate contact tracing to identify all students and staff members who have been in close contact with an infected individual in the school setting. Contact tracing should be done individually for each person identified with COVID-19, and we're going to talk a little bit later about what the definition of that is. And contact tracing slows the spread of COVID-19 in a setting where risk for transmission is very high, as there are a lot of people close together and it can spread quite rapidly. So contact tracing identifies people that may have been exposed, asks them to monitor their health, and then asks them to self-quarantine during the period of time where they may develop symptoms as they've been exposed. Timely and thorough contact tracing can effectively interrupt the chain of disease transmission, and it's an important public health intervention to prevent or contain an outbreak. And by keeping those that may have been exposed to COVID away from others, further transmission may be prevented. And this, again, is the way that we're going to be able to keep schools open. So there are three main steps to conducting contact tracing in schools. The first is to identify COVID-19 infections and report them to LDH, or the Louisiana Department of Health. The second is to identify and notify close contacts. And third is to conduct cleaning and disinfection. So we're going to walk through these steps, and this is also reflected in a document that is posted online, which I'll talk about in a little bit. So identifying COVID-19 infections in schools. For the purpose of identifying infections in schools and conducting contact tracing, we're talking about two types of cases: a lab confirmed case or a suspect case. And we are asking schools to conduct contact tracing for both of these types of cases. So the first is a lab confirmed case. That's going to include a molecular or PCR test or an antigen test. And we do recognize that a lot of people are not familiar with the different types of tests, but in general, a PCR and antigen tests are both going to detect the virus in a person. They're both nasal or nasopharyngeal swabs. Some of them are rapid, but some take days to turn around. What we're not counting is antibody tests, and antibody tests are going to be where blood is drawn, and it's detecting antibodies in the blood, which indicates a response to an exposure to COVID. It does not reflect a current infection. So for the purpose of identifying cases and conducting contact tracing in your schools, we need to be really specific about what kind of positive tests are being reported by staff members or students. And we're only looking at PCR or antigen tests. A suspect case, there's a few different criteria that would define a suspect case. The first is a clinical diagnosis of COVID by a medical provider based on symptoms. The second category is if somebody has one of the major COVID symptoms, which are cough, shortness of breath, difficulty breathing, or new changes in sense of smell or taste, and no alternative diagnosis. So if you have a student who has shortness of breath, but they've been diagnosed with asthma, for example, that would not count as a suspect case. And the third criteria is if you have at least two of the minor COVID symptoms, which are fever, chills, rigors, muscle aches or myalgia, headache, sore throat, nausea or vomiting, diarrhea, congestion or runny nose, or fatigue. And we're talking about major fatigue, not just, the student is tired because they didn't sleep last night, like fatigue indicating illness. And again, no alternate diagnosis. So again, we're asking schools to identify cases that fall into these categories based on symptoms or test results or clinical diagnosis, and to conduct contact tracing. So if someone has one of these symptoms, but they don't meet that clinical or laboratory criteria on the previous slide, they should be sent home and they need to not return to school until they are symptom-free for 24 hours. And contact tracing does not need to be done for these individuals. So we're only talking about suspect or lab confirmed cases to conduct contact tracing. So once a COVID-19 infection is identified, the ill person can return to school, or positive person can return to school when the following criteria are met. So if this person does have symptoms, they would need to remain out of school until at least 10 days have passed since their symptoms first appeared. And it has been at least 24 hours since they've had a fever without the use of fever reducing medications. And they also, their other symptoms have improved. And that is not really defined further, but basically it's not 10 days plus 24 hours no fever. If you have gotten to that 10-day mark and they have also not had a fever for at least 24 hours and their other symptoms that they're experiencing have improved, they may return to school. For someone who is tested positive but does not have any symptoms and doesn't have symptoms for the entire 10 days, they can return to school once they have met the 10-day mark from their test collection date. So the day that they went to get tested, they need to isolate for 10 days from that day. And you want to isolate and send the person home immediately so that they are removed from the school setting and are not further exposing anybody else. And then once you identify someone with COVID-19, a suspect or lab confirmed case, we're asking you to report that case to the Louisiana Department of Health. And we've worked in consultation with the Louisiana Department of Education to develop an early warning system for COVID-19 in schools, which we're calling the School COVID-19 Reporting Portal. And this is a case-based secure online reporting system that was created to aid schools and public health officials in monitoring and mitigating the potential for school-based outbreaks. So as soon as we have a suspect or confirmed case, we'd like you to report it and also conduct the contact tracing that we're going to go through in a minute in the school setting. If you have questions about this school portal, Sean's going to do a demo in a minute, but you can also email any questions regarding the portal to this school COVID reporting at la.gov email. And if you have a case or cases and request consultation from the OPH regional office, you can find their contacts at this link here, or you can Google Louisiana OPH regional offices and reach out for assistance in that way. And you also, most of you probably already have relationships with your regional offices. So steps number 2, the steps to identify and notify close contacts once you have that identified suspect or lab confirmed COVID infection. So you need to determine who has been in close contact with the person who has an infection or possible infection in school during their infectious period. So again, we're not talking about who they had close contact with outside of the school setting. We're only talking about the school setting. And then you want to notify those close contacts. I'm going to go into more detail in these steps in a minute. You also want to ensure close contacts remain out of school until the end of their quarantine period, and consider notifying the entire school community that a person with COVID-19 infection has been identified. So to determine who has been in close contact with the person with a COVID infection during their infectious period, a close contact is defined as being within 6 feet of an infected person for at least 15 minutes, or having had direct contact with an infected person. That would include touching, hugging, kissing, sharing, eating or drinking utensils, or if someone sneezes, coughs, or somehow otherwise gets respiratory droplets on another person, because the respiratory droplets are going to contain the virus. And so if direct contact in that way has been had, that would also be considered a close contact, even if the duration was not 15 minutes. And we need to focus on the infectious period. So when is this person who has a suspect or confirmed COVID infection, when are they contagious? And that period starts 48 hours before the day that they became sick. If they don't have symptoms, it's 48 hours before their specimen was collected for testing. And then it goes through the remainder of their isolation period. So when you identify a case in a school, you want to really look at the period from that day that you've identified them and go all the way back to 2 days before they either developed symptoms or had a test collected. And the use of face coverings and plastic dividers, while they are recommended because they do reduce the risk of transmission, they are not considered in determining close contacts. So if you have a student who was within 6 feet of another child for 15 minutes, but there was a plastic divider between them, that is not used in the determination of whether that person is a close contact or not. They would still be determined to be a close contact if they were within 6 feet for at least 15 minutes or otherwise had direct contact. And then you want to identify the close contacts that may have occurred at any time during when the person was at school during the infectious period that we talked about. And this includes in the classrooms, on school buses, during recess or lunch, and during any extracurricular activities or any other activity where that student was interacting with other people in the school setting. If a close contact is identified who was diagnosed with COVID-19 by a PCR test within the last 90 days, and they do not have any symptoms, they do not need to quarantine. And the idea behind this is that CDC has put out guidance that if someone has a COVID infection, and that's a confirmed COVID infection, this does not include an antigen positive test. We're only talking about positive PCR tests here because that's the more sensitive test that is detecting the nucleic acid of the virus. So if they don't have any symptoms, they don't need to quarantine, because the idea is if they had an infection within the past 3 months, they have enough immunity that the risk of them becoming symptomatic again and transmitting to others is very low. So CDC recommends, and as do we, that they do not need to quarantine if they don't have symptoms and had a positive PCR test within the last 90 days of their exposure to another case. If you have somebody that had a recent infection within 90 days, they've been exposed and they do have symptoms, then they should self-quarantine immediately for the 14-day quarantine period. And we recommend they consult with a medical provider to determine if they may have been reinfected with COVID or if their symptoms may be due to something else. And then you want to notify all close contacts that they have been identified as having been exposed to someone who is or may be ill with COVID, and that they'll need to quarantine and stay out of school for 14 days from the last day that they were exposed. We do have a template letter that can be provided by the regional offices of public health, or you can develop your own. And the important part there is to determine for each close contact when was their last exposure, and then indicate that they need to quarantine for 14 days from that last day that they were exposed, and they need to remain out of school for that time. And we ask that you encourage close contacts to call the Louisiana Department of Public Health contact tracers at 1-877-766-2130. And that is so that the contact tracers can provide them with additional information to safely quarantine and also monitor their health during the duration of their quarantine period. So close contacts should not return to school until 14 days have passed from that last day that they were exposed. If a close contact in quarantine becomes symptomatic and receives a positive test by antigen or PCR, they would be considered a case as of the day their symptoms began and would need to follow the end of isolation criteria that we talked about on slide 6 to return to school. So again, that's 10 days from their onset date. They also need to have been fever-free for 24 hours and their other symptoms have improved. If you have a close contact in quarantine that becomes symptomatic but is not tested, they would also be considered a case as of the day of their symptoms began, but they would need to either follow the end of isolation criteria or the 14-day quarantine, whichever is longer. Since we don't have confirmation that they have COVID if they haven't been tested, they need to follow the criteria that would result in a longer exclusion from school to ensure that they don't later become infectious with COVID and transmit it further. If a close contact in quarantine tests positive but does not develop symptoms, they would be also considered a case as of the day their test was collected and would need to follow end of self-isolation criteria that we talked about earlier. If a close contact tests negative during their quarantine period, they should remain in quarantine for the duration of the 14 days and continue monitoring for the development of symptoms at any time during the quarantine period. And this is because the quarantine period of 14 days is based on what the longest incubation period for COVID could be. So the incubation period is the time from when you were exposed to when you may develop symptoms. And so even if somebody tests negative, that doesn't get them out of quarantine because they may still develop symptoms later on in their quarantine. So regardless of a negative test, somebody who hasn't been in close contact and has been exposed does need to continue to quarantine for the 14 days. If a negative PCR test is received on a suspect case, so you have someone that meets that symptom criteria, they go and get a test and it's a PCR test and it's negative, they may return to school after they are symptom-free for 24 hours. This does not, we are not considering antigen negative tests for suspect case to rule them out of isolation because antigen tests are less sensitive. So if we have a negative antigen test, we're not entirely sure that they are truly negative. If they have a negative PCR test, then you can end isolation for them once they are symptom-free for 24 hours and they may return to school. You can also immediately discontinue quarantine of close contacts of those individuals, of the close contacts that were identified. And we do ask that you please update the entry in the online reporting system form for that person and indicate that they had tested negative by PCR and so are no longer considered a suspect case. And when you do have these suspect cases that have symptoms but have not yet been tested, we do encourage you to encourage them to get tested because they may end up releasing their close contacts from quarantine with that negative test. And we can also just have better confirmation if you do truly have COVID transmission in your school or not. The last step that we recommend is to consider notifying the entire school community. And we recommend this not only that there has been a person identified who may have COVID infection, but also that all close contacts have been notified. This is recommended really to get ahead of the rumor mill, because if you do have a case or a suspect or confirmed case in your school and you have notified close contacts that they need to quarantine, you know, I think we all know that the word will get around pretty quickly. And so to inform all parents of the situation might help you in the long run. So, and I know DOE has some template letters for notifying the school community if there has been a case. The third step is cleaning and disinfection according to CDC guidelines. And at the end of the slide, I have the full CDC cleaning, disinfection, hand hygiene in schools guidance. But what you want to do is close off areas used by the person with COVID and wait as long as practical before cleaning and disinfection to minimize potential exposure to respiratory droplets. So you want to open outside doors and windows if possible to increase air circulation in the area, again, to get rid of those respiratory droplets. And if possible, wait up to 24 hours, but as long as it's practical, wait before beginning cleaning and disinfection. And you want to clean and disinfect all areas. So be thoughtful about, you know, what are those high touch areas, the offices, bathrooms, common areas used by people with COVID, doorknobs, light switches, desktops, of course, focusing especially on frequently touched surfaces. And the surfaces should be cleaned using soap or a detergent and water prior to the chemical disinfection. For disinfection, most common EPA registered household disinfectants should be effective against the virus, and you can find the full EPA approved list on this link here or by Googling. I also wanted to point out that there is a new list of resources on our LDH COVID website, and this will continuously be updated. The LA School Reporting Guide does provide a step-by-step instructions for how to report COVID illness among school students or staff. And the COVID Schools Worksheet is a tool that can really help schools make sure they're collecting all the important information when you are receiving a report of a parent, you know, from a parent or a staff member that they have a COVID-related illness. So this can be really helpful. That's found on the website and the link is right there. so that you know exactly what questions to ask when somebody's reporting a possible case. The COVID contact tracing in schools document is pretty much what these slides were based on, but you can find the full document online. And contact tracing worksheet for school staff and parents. So this you can give to staff or parents that are reporting illness, and it helps them think about who are their close contacts, what is their infectious period, for if they do test positive, to then have that information for the contact tracers that would be calling them, or mainly for outside of school contacts, as since the schools will be identifying the contacts that occurred at school, and would be harder for the parents to know who all those folks were. And then the last is PPE for schools. This document goes through all the different categories of staff members in the school and what kind of PPE is recommended for them to wear. So that's also a really helpful document. And I'm now going to hand it over to Sean, who's going to take us through the school COVID-19 reporting portal.
Hello. This section of the webinar describes the school COVID reporting portal. First, we will provide a quick overview of the system, and then we will have a demonstration on how to register and submit a case. So, an administrator from each school will receive an email from School COVID Reporting at la.gov with a unique link to their school-specific reporting portal. At this point, all emails have been sent to the contacts provided. If you are unable to locate the email in your inbox or junk folders, please contact School COVID Reporting at la.gov with your contact information and the school's name and location. The first time you click the link, you will be taken to a registration page where you will be asked to confirm some facility information and set a password. This link and password should be shared with anyone in the school who will need to access the system to track, submit, or update reports. This portal is meant to assist with tracking all confirmed and suspect cases of COVID in the school setting. This includes anyone who has tested positive for COVID, anyone who has one of the major symptoms without an alternative diagnosis, or anyone who has two or more of the minor symptoms without an alternative diagnosis. This includes faculty, staff, and students. Please note that this is not a daily reporting system. The portal only needs to be accessed when there is a new confirmed or suspected case identified, or when a report needs to be updated. Please remember to update reports as necessary. If an individual is a suspected case who gets tested, it will be necessary to update their test results so that they will either be classified as a confirmed case or as not a case. Also, isolation status should be updated to document that individuals are able to return to school. Now we are going to have a demonstration on how to register and submit a case. As mentioned, an administrator for each school will receive this email from School COVID Reporting at la.gov with a unique link for their school. You can either click the link or copy and paste into your browser. So the survey will open. A user guide can be downloaded using the link at the top of the survey. First, you will be asked to confirm your school's information. If this information is incorrect, please select incorrect and provide the correct information in the fields that appear. Otherwise, please just click correct. You will then be asked to provide your school district, diocese, or charter, your parish, your grade configuration, and the census of students and staff members. You will then be able to set your password. This is the password that will be needed to submit, view, and update individual case reports. So we'll go with COVID, and then click submit. Once the initial registration has been completed, this same link will always bring you to the school's reporting portal. Please save the link somewhere safe or bookmark it. If you lose your link, please contact School COVID Reporting at la.gov or the email address from the email address registered to your school. To report a case, select Begin Survey. You will be prompted to provide your password. This survey collects basic demographic information about the case, whether they have been tested. It also collects symptom information and their last date at school. This information should be collected to ensure that individuals are excluded or isolated appropriately. The survey also allows the school to document all actions taken after this case was identified, including identifying close contacts within the school setting and documenting that the individual is now isolating. Once you submit, you can download a PDF of your report for school records and tracking purposes. You can update or modify this report by clicking Edit Response or report a new case by selecting Report Another COVID-19 Case. If you have any questions about utilizing this portal, please refer to the user guide linked in the initial email or contact school COVID reporting at la.gov. Thank you.
Thank you everyone for joining. And as Sean said, if you have any questions about the reporting portal, please email schoolcovidreporting@la.gov. And if you have questions or require consultation, please contact your regional Office of Public Health office. Thank you.